Lynda, residents in the hotspot areas face $1,000 fines if they do set foot in the SCG. Is that fair?
Well, we've always taken the view that we shouldn't have crowds at the cricket. So if a public health order, at least for those suburbs, keeps Sydney safe, I think that's appropriate. But can I just clarify, and I spoke to the Minister for Health about this yesterday, Lidcombe North doesn't actually adjoin Berala, it's Lidcombe South. I don't know why they've picked Lidcombe North, and they'd be much better when they do the public health order actually just banning the suburb of Lidcombe, because there is not two different entities within that suburb.
Let's talk about the current situation there in your area. There had been concerns yesterday that the message wasn't reaching migrant communities when it does come to getting tested. Has that message now been clarified?
Well, there's still a lot of confusion. There's two problems here. One is that people are being asked for their Medicare cards when they attend clinics. A lot of people in my community don't have Medicare cards. Thousands of them don't. That's keeping people away. Another problem is that people are being charged for the tests when they turn up at some of these testing sites that the government's recommending they're going to. They also don't get their news from the mainstream media. So it is starting to get through. I've got a letter that should be hitting their letterboxes today that's keeping them informed, and that's in English and in Chinese as well. And there is more information going out. So hopefully people will understand that the tests are free, but we need to just clear up this problem with the clinics that are charging people.
And can you explain to us which clinics are charging people? Are these public clinics and private clinics, and how much are people being charged?
So the government has a list of clinics on their website, and some of them are private and some of them are run by New South Wales Health. Obviously, New South Wales Health is not charging people, but is asking for Medicare cards. The clinics are the private ones. I had someone go yesterday to one of the clinics. They were charged $120 to have their child tested because their child wasn't entitled to a Medicare card. Other reports I've had at one of the other clinics is that it was $100. I've also got people that have presented me with bills that they've got from GPs for $50.
Is it possible that these people could attend public clinics?
Well, no, the problem is, and this is how we originally became aware of the issue, was that one member of the family would go down, get tested. He would be asked for his Medicare card. He would go back and tell the rest of the family, well, you can go because you've got Medicare cards, but my cousin can't go, uncle can't go because they don't have Medicare cards. And that was where some of the problems with the free New South Wales Health Clinic was being run. Another problem was there was no testing site in Berala. We've now last night had a pop-up centre in Berala Public School open, so people can go there as a walk-in. There was also no walk-in clinics that people could go to.
Are there enough clinics in the area to meet the current demand?
I think with the Berala Public School clinic opening now that will alleviate a lot of the problems, because many people don't have cars, they don't go to the drive-in clinics, and that'll help significantly.
The Health Minister Brad Hazzard yesterday said that the onus should be on multicultural community leaders to ensure that the messages are getting through about what venues are impacted and testing rates. Do you think that's fair? Should the message be on the multicultural leaders?
Well, I spoke to Brad last Friday and I told him how important it was to make sure the message got down to ethnic communities through the radios, but many of the people do get their messaging from their community groups. Now, the onus isn't on the leaders to do that. It's on New South Wales Health, who used to have a multicultural health unit, to have some kind of connection with these community groups so they can get their messaging to them. Unless the community leaders actually know what's going on, it's very difficult for them to deliver a message to their communities.
It's obviously a very precarious situation right now, particularly in these hotspot areas. What's the mood like in the community?
Well, it's mixed. To some extent, Berala is an interesting suburb because, unlike most of the rest of the electorate, the main roads ring around it. So people that have been to the BWS and to the supermarket probably come from within that region. So to an extent, it will be a bit contained. The problem will be, as we've seen with the Orange, Nyngan and Dubbo visit, is that people then go and visit other people from outside of the Berala region. So, obviously the shops are nearly all closed there except for the chemist and the supermarket. It's everyone is staying at home. They're doing the right thing, but obviously we don't know where we are at the moment. The school holiday, kids have been moved out of Berala Public School, and that's another burden for the local community because the kids have been placed into the other schools because we're using the school as a pop-up clinic. So there's a big impact on the community, but they're a pretty resilient bunch in Berala.
Yeah, good to hear. Just finally, Lynda, what would be your message to the community?
Go out and get tested. It's free to get tested. You don't need your Medicare card. They just need your name and phone number. So Berala Public School is the place to go. You can walk in there. It's very close to the shops. That's the best option for the local community.
Lynda Voltz, appreciate your time.
No problem.